Hello everyone, welcome to Low Tech Whiteboard Learning, and today's talk is about pressure. We measure a lot of different pressures. You might think of blood pressure, you might think of central venous pressure, intracranial pressure, the pressure of gas in your system, so end-tidal CO2, or the gas pressure in your anesthetic system. So there's different kinds of pressures, but let's talk about what is pressure? So pressure is the force of a molecule against another interface. So like if it's air inside a balloon, right? As you blow up, put more air into it, the pressure would increase if you measured it. The other thing would be volume. If you put more liquid in a balloon, the pressure inside will increase. And the easy way to measure that, they found, was to standardize how much pressure a substance exerted against an interface that was a certain material, and that would displace it on a column. So here I'm drawing a column of, let's say, a substance, a liquid, and I have pressure pushing down on that. Let's say this was atmospheric pressure. So this is the pressure of air, and it's pushing here. It's going to displace that column of liquid a certain amount on a scale. And if you think about that, you remember that atmospheric pressure is measured in millimeters mercury. So that's actually mercury in your column, just like used to be in the old-timey thermometers. And atmospheric pressure is 760 millimeters of mercury. And that basically means that at sea level, the pressure of air on us is about enough to move mercury 760 millimeters. So in comparison, let's think about a different item pushing down on the interface. Let's talk about blood. So if we do blood pressure pushing, what's the pressure of blood? The blood pressure pushes maybe only 120 millimeters mercury. So it's sort of the same unit, but it's very much high pressure and a lower pressure. Although it is, pretty high, it squirts and everything like that, but it's the same scale. So it's basically the pushing of a column, and then there's some sort of what we call a manometer or a measuring device to push that column. Now the other way that we measure sometimes scale-wise is in centimeters of water. So this could be water instead here, and you're going to move things in centimeters water. And usually that is more reserved for things like gases. So that might be anesthetic gases. Central venous pressure is one that's a liquid that we do in centimeters of water, a lower pressure system. So the difference between centimeters water and millimeters mercury is about 1.34. So for just so you can figure out, if we had 10 millimeters of mercury, that would be about 13 centimeters water. So think about that as far as this is about 10 centimeters, and then this is about 10 millimeters, right? So you're going to use something with a lot less pressure to push on a centimeter scale of water, because that's a lighter fluid than mercury, which is heavy and thick, which is going to be on a different, smaller scale. So that's all that really is, and why we measure it. So things that are of generally a lower pressure range, we're going to use centimeters of water, and things that are a higher pressure range, we might use millimeters of mercury. But you know what? It's really actually arbitrary, and that was just decided when scientists made up these measurements a long, long time ago. But the pressure we're going to talk about specifically today is blood pressure. So in order to talk about blood pressure, you have to talk about how the heart pumps. And so, because blood pressure is divided, as you might hear, into, have heard before, systolic, diastolic, and then there's a mean blood pressure. So let's think about our heart here. And it's going to be a really oversimplification of pumping. So then we're going to have a pump. There's a little pump, muscles here. And it's going to eject blood out. And then I'm going to measure blood pressure down here with a little cuff and a Doppler, because that's just one way we measure blood pressure. And so I'm actually going to be measuring the pressure as it goes a little further away from the heart, not when it's first ejected. Well, what do we know about arterial blood pressure? So this is arterial, right? Not venous. Venous would be a lot lower because obviously we're not having a pump right nearby. That venous would be on the way back. So arterial blood pressure has two phases because the heart pumps and then relaxes. The thing that's in between the heart and the measurement of the blood pressure in the artery down here is a valve, the aortic valve. And what does the aortic valve do? Well, the aortic valve will open during systole, or the pumping phase, pump. And it will snap shut in diastole. So this is the rest phase of the heart. Now, why does it snap shut? Well, this is a one-way pump. And when things come into the heart, they want to get pumped out. They don't want to go slushing back and forth. You want the movement of the blood to only go forward. So let's say the heart compresses down and it's pumped out all of its fluid. When it expands back out and the muscles go retract, that could actually create a vacuum and suck blood back into the heart if there wasn't a valve here to stop it from going backward. So the valves are very important, and the heart obviously doesn't work very well without them. We know that from valvular disease problems in cats and dogs. So once that the valve opens, the blood pumps forward. That's a systolic pressure. And when the heart is going to go relax and the valve shuts, that's the diastolic pressure. So it would make sense that systole is a higher pressure than diastole. And there is a range in there. And so if you look at blood pressure over time, so if here's 120 millimeters mercury, and here's 80, 120, my pen isn't working great, and here's 80, the pressure is going to go up when the heart pumps, down, up, down, up, down, up, down, up, down, right? So there will be your systole pressure, and here will be at the bottom your diastole pressure. Because obviously this isn't happening like boom, boom, it's happening push to maximum pressure, systole, relax to minimum pressure, diastole. So that's what we can measure a little bit better with a direct pressure, which isn't a Doppler, which actually sticks a catheter in here and then goes to a pressure transducer computer, instead of with Doppler, which really has a hard time differentiating those two. Sometimes you can, but sometimes you don't. So systole is the highest pressure, diastole is the lowest pressure at rest. And if you think about it, in a normal patient, which of those two phases predominates? Diastole, right? Your heart rate's only 60 times per minute, so most of the time your heart is resting. So it'd be a spike, rest, like that. Now, if your heart rate is very high, there's less time to rest in between. And that is how we actually end up talking about the mean pressure, which cardiologists think is more important than your systole, is what is your average pressure over time. Mean just means average. So the average over time has to include what phase are you in over time the most. And that's why it gives more weight to what you're doing in diastole than what you're doing in systole. So the measurement for mean arterial pressure is 2 times diastole's pressure plus systole's pressure divided by 3. It's basically saying that it's the average over time, but that diastole has a bigger component because your heart is usually in the rest phase more often. And so the mean, it actually is about a third above the diastolic pressure. So that's the talk for today on pressure. I hope that made sense. And if you have any questions, let me know.